Hi everyone. Today we are going to discuss about an important class of drugs that are tetracyclines. So the name itself says that these drugs have four cyclic rings in their structure. So basically these are very broad spectrum antibiotics. These drugs have good activity against atypical bacteria like chlamydial, mycoplasma, rickettsia like scrub typhus, borrelia, brucella, Vibrio cholerae and treponema and syphilis also these can be used. So these drugs are mainly bacteriostatic. That means they do not directly kill the bacteria, they prevent the growth of bacteria by inhibiting the protein synthesis. In coming few minutes you will know the exact mechanism how these drugs act on bacteria. So these tetracyclines are taken up by the bacteria by active transport. This active transport mechanism is absent in mammals. So these are selectively toxic to bacteria. After this, they bind to 30S ribosomal subunit and attach it to A site so that they can compete with and prevent binding of tRNA to the A site. So what is this A site? I will tell in the next few minutes. So that they can inhibit the protein synthesis. They do not directly kill the bacteria, they will stop the growth of bacteria. So this is the important diagram that you have to remember. The black line is mRNA, the red one is ribosome, big one is 50S and small one is 30S, and these three are EPA sites of ribosome which are very important in translation. Generally, tRNA comes to bind these sites on ribosome mRNA complex to form proteins during translation. And now our tetracycline bind to 30S ribosomal subunit and prevent the binding of tRNA to A site on mRNA ribosome complex. So here another drug, chloramphenicol, which is rarely used now due to its side effects, binds to 50S subunit on P site and inhibits transpeptidation reaction. It is also a bacteriostatic drug. In high doses, it may be a bactericidal. Now we are moving to classification. Short acting means half-life is 6 hours. Intermediate acting is half-life is 12 hours. Long acting half-life is 18 hours. So short-acting drugs are tetracycline, and oxytetracycline, which are rarely used nowadays. And intermediate-acting are like demeclocycline and metacycline. Nowadays, we are using long-acting drugs like doxycycline and minocycline. Their half-life is around 18 hours. And newer agent is tigecycline. In its half-life is around 36 hours. So coming to intermediate acting demeclocycline, this drug is the most potent inhibitor of V2 receptor in kidney. For this reason, it can be used to treat SIADH. For the same reason, in normal people, because of inhibiting V2 receptors in kidney, there is a condition called diabetes insipidus. So this drug can cause diabetes insipidus as a side effect, and it can also treat SIADH. So this is an important thing to remember. Coming to tigecycline, basically it is a glycycline and it has a similar structure to tetracyclines. Only doxycycline, minocycline and tigecycline can safely be given in renal failure also. Coming to some specific drugs, doxycycline is found in higher levels in prostatic fluid, hence it can treat prostatitis also. Minocycline is found in high concentration in saliva and tears. So we can use this in meningococcal carrier state. So coming to the newer drug, tigecycline. So tigecycline is basically used in complicated skin and soft tissue and intestinal infections due to resistant gram-positive MRSA and VREF. MRSA is methicillin-resistant Staphylococcus aureus. VREF means vancomycin-resistant Enterococcus faecium. And also gram-negative and anaerobes also. So another important thing about tetracyclines is these drugs chelate divalent cations that are calcium, magnesium, zinc, ferrous, like these cations. So if patient is on treatment for these any of these supplements, we advise patient to stop these supplements at least for a week when they are started on tetracyclines. So some of the side effects of these tetracyclines are tooth enamel dysplasia and decreased bone growth in children is commonly seen. For the same reason, they are considered as teratogenic. So, as earlier said, tetracyclines chelate calcium. The calcium tetracycline orthophosphate complexes get deposited in the developing teeth and bone, and that's why the teeth and bone abnormality occurs in children. Another important side effect is phototoxicity. This is because tetracyclines absorb UV light. So, when patients are on these tetracyclines on exposure to sunlight, dark skin dermatitis can happen. So, we should advise the patient to apply sunscreen lotion when they are using these tetracyclines. Along with this, general gastrointestinal disturbances like nausea, vomiting can occur. Supra infections are more common with these tetracyclines, like candidiasis, colitis can happen. So vestibular disturbances is most commonly seen with minocycline. Pregnant women on high exposure to tetracyclines can develop hepatic dysfunction. So this drug can also cause pseudotumor cerebri in infants. So this is a very teratogenic drug. Thank you for watching.